Hi, I'm Brooke Claybot, and I have Lillian Lambrix and Sammy Crook here. We'll be your nurses today, and we'll be teaching you about PTSD.
Thank you for joining us. This is our presentation on post-traumatic stress disorder. Our objectives for this presentation is that the patient will understand signs and symptoms of the diagnosis. The patient will recognize common interventions used for PTSD, and the patient will be able to implement successful strategies to manage symptoms. Post-traumatic stress disorder, otherwise known as PTSD, is something that occurs after you have something scary happen to you. You know that you are feeling this or experiencing this when you're feeling some of these symptoms. So if you're feeling anxious about things, you have some trouble sleeping, you feel lack of energy or lack of interest in doing the things you normally enjoy, this could be happening to you. If you self-medicate using some substances that you are overusing to feel a little bit better, this could also be caused by PTSD. You can sometimes feel aggressive or angry at people, or the slightest thing might tick you off. You could feel guilty, or you could feel dissociation. There could be a strain on your work or your ability to perform and do the things you normally do, or you could have pain in areas that are chronic and don't go away. You could have a headache, or you could be super alert in situations that don't need you to be alert in.
When assessing a patient for PTSD, we will be looking at 5 different criteria. The first one is exposure. What this entails is experiencing a traumatic event, witnessing an event that occurred to others, learning that a traumatic event occurred to somebody close to you like your family or friends, or being a part of a profession that is constantly exposed to adverse events like first responders, police officers, or social workers. The second criteria we'll be looking at is intrusive symptoms. What this means is recurrent and intrusive memories like nightmares and flashbacks. During this time, you may be experiencing intense distress at exposure to the traumatic event that you witnessed. During this time, you may be experiencing an increase in your heart rate or blood pressure as well. The third criteria we look at is avoidance. What this entails is avoiding memories or thoughts that are associated with the traumatic event. The fourth criteria we look at is negative changes in your thought process and your mood, which may include memory loss related to the event, persistent negative emotions, decreased interest in activities you once were very interested in, and persistent inability to experience happiness. The fifth criteria we look at is arousal and reactivity. What this entails is irritable behavior or angry outbursts. You may be experiencing reckless or self-destructive behavior or problems with concentration and sleeping. Finally, the last criteria is duration. So for PTSD, you may be experiencing this for more than 1 month.
Medications that are typically used for PTSD include selective serotonin reuptake inhibitors, otherwise known as SSRIs. SSRIs increase the serotonin levels in your brain, which helps to reduce anxiety. Some side effects include drowsiness, nausea, vomiting, dry mouth, and blurred vision. Some serious side effects can include shaking, restlessness, changes in sexual ability, and seizures. If you experience fever, twitching muscles, hallucinations, severe dizziness, this could indicate serotonin syndrome or serotonin toxicity, which would require you to get help from a doctor. The 2 SSRIs that are typically used to help the symptoms of PTSD include Paxil and Zoloft. Other drug therapies that can be used include alpha agonists like clonidine, which is a hypotensive agent. Right after the event occurs, prazosin can be used in order to decrease nightmares and flashbacks. Some non-pharmacological methods that are used to help with the symptoms of PTSD include imagery, yoga, deep breathing techniques, relaxation techniques, and also therapy called EDMR. Another therapy that is used for PTSD is eye movement and desensitization and reprocessing therapy. So this is when both sides of your brain are stimulated to process the memories of the traumatic event that you've experienced through adaptive information processing. So it helps your brain process the traumatic event that you've experienced. The therapy that is used is exposure therapy. This is used to target the learned behaviors that people use after experiencing the negative event that's happened to them. Cognitive therapy is also used for patients with PTSD. This includes speaking with a therapist about the traumatic event that you have experienced and kind of brainstorming ways to get around the intrusive thoughts that you've been having or the negative side effects that you've been having.
Based off of some of the techniques Brooke discussed with you earlier, I'm going to teach you guys on 4 other types of techniques that you can practice when you're feeling periods of anxiety or weariness caused by your PTSD. The first one I'm going to talk to you about is guided imagery. This is a form of relaxation that will help you counter the stressful inner events you may be experiencing by replacing them with positive experiences. The ultimate goal in this type of technique is to help you step out of your feelings from the past and to focus on the future by providing you with a calm, supportive, and safe environment. The second one is yoga. Yoga can be beneficial in treating symptoms of PTSD by meditating on and the underlying importance of being aware of your breathing, the movements of your body, and your feelings during this moment. It highlights on mindfulness, focus, and relaxation, and can help you manage the process of how you react and feel to your traumatic events. The third one is deep breathing techniques. This can help you cope with the symptoms of anxiety or feelings of panic caused by PTSD. It is important to learn how to properly deep breathe by using your diaphragm rather than your chest and your shoulders. So we're going to go through a few of the steps on how to properly deep breathe. First, I would like you to find a comfortable position, either lying on your back or sitting. You can close your eyes at this moment. Place your hand on your stomach rather than your chest. Place your hand on your stomach and the other on your chest. Take a few breaths and make sure your stomach is rising and falling with every breath in and out. Continue by taking deep breaths and concentrating on the movement of your stomach. Continue this process as long as you would like until you feel relaxed. The final relaxation technique I will discuss with you is physical exercise. Aerobic exercise like running, walking, or swimming can help alleviate symptoms of PTSD by positively impacting your levels of serotonin in your brain. It is proven that higher levels of serotonin helps boost your mood, sense of well-being, improve your appetite, and will help your sleep cycles.
So we use some assessment tools to see the severity and type and see if it really is PTSD. One of the ones we use is Primary Care PTSD Screen. The second one, if it's positive, we will then move on to the Severity of Post-Traumatic Stress Scale. It's a mental status exam. We need to collect data on the onset, frequency, course severity, level of distress, and degree of functional impairment you have. So we're going to ask you questions on if you have any suicidal or homicidal thoughts. We're going to ask you about your family and your social supports. We're going to ask you if you can sleep well or if you've been away from your friends a while. We're going to ask you about the stressors in your life, the medications you've been taking, and your medical psychiatric history.
A community resource for PTSD in Lincoln is this link that we've provided for you. If you go to this link, it'll show all the therapists in Lincoln that specialize in treating PTSD, and it also will let you choose your preference if it's female or male therapist. It gives you the zip code that you live in so you can find a therapist near you, and you can also select the price that you would like to pay, and it'll help you find the therapist.
Now it's time to evaluate our objectives. First, did the patient understand the signs and symptoms of the diagnosis? Next, does the patient recognize common interventions used for PTSD? And lastly, is the patient able to successfully implement the symptom management strategies we taught?
Throughout our presentation, we discussed with you the definition and causation of PTSD. We presented the common signs and symptoms of someone who is experiencing PTSD. In addition, we included the diagnostic criteria and screening tools we use to help determine whether or not it is PTSD that you are suffering from. We discussed the pharmacological and non-pharmacological interventions used to help treat a person suffering from PTSD. Finally, we provided a community resource that can help aid in the path towards recovery from PTSD.